Hi guys, so Nick Ferrari is a simple man, in the sense that he can only come up with simple solutions to complex problems. So on Tuesday he was rightfully complaining about the problem of people filling up hospitals during this pandemic. Now, according to government data, a majority of people in hospital with the virus are people who have either rejected or are unable to get the jab. This is a serious problem and it needs to be dealt with. But Nick Ferrari's solution isn't really a solution, and I will explain why. First, let's hear what he has to say.
As we now know, the provision of NHS care, whether it's in hospitals, whether it's in clinics, whether it's at your GP, they are bouncing on the bottom at the moment because of COVID. It is time for radical action. And today I propose to you that you all have 12 appointments per annum, okay? Which obviously works out at one a month. After that, you will be charged, unless it is a desperately serious case, such as cancer, or whatever it might. Obviously, that means all bets are off. You go into a different bracket. But if you constantly come along and say, I've got a bump on my bottom, or I've got earache, or I don't know, I don't feel well, I don't think I can go to work, whatever it might be, the myriad of complaints that confront those poor men and women, the army of GPs, you'll effectively get one a month free, after which you'll be charged somewhere in the order probably about £50 to £60. It will not be means tested. That will be the end. If you do not attend an appointment, by the way, that will count for 3 of your 12, and you'll be fined £100 for not making an appointment. Unless you call and say, I'm stuck in traffic, or whatever, had cheese and wine party at number 10 and I just can't get away because we're all in suits, then you will be permitted. But if you don't, you'll be fined £100 and you'll go down to 9 a year.
Okay, so much to say about this. This is about, look, the problem is not so much the people, the problem is the underfunding of the NHS. But this specific problem about people overloading the NHS during the pandemic is something that needs to be dealt with. But I think he's talking about something more general here. Now, Nick Ferrari, I don't think, is a doctor. He's not a medical expert. So, you know, if you have a bump on your bottom, it could be something more serious. So it shouldn't be something that you should just ignore because, well, I don't want to use up my 12 free trips to the doctor or to the A&E or whatever. That's a stupid idea. You know, an earache. Oh, well, you shouldn't use that either because it's not... Like, Nick Ferrari's not a doctor. He can't diagnose whether an earache is something, you know, something very simple or something more dangerous, something more complicated, something potentially life-threatening. We don't know that until you actually go to the expert. Isn't Nick Ferrari a Brexiteer? You know, anyway. Look, this idea... Does Nick Ferrari, you know, come up with these things, you know, while he's having a shower or he's sitting out, you know, waiting for the coffee machine to distribute that wonderful goodness into a cup, and he comes up with these wonderful ideas? I don't know. Like, there's so many problems with this. For example, people with chronic conditions. It doesn't have to be a very serious illness, but a chronic condition that could require you to visit your doctor every month or a couple of times a month, even once a week or something like that. Are these people included or excluded? What about somebody who's had an accident and needs physiotherapy, for example, with broken bones? Are they included or excluded? What about mental health issues, where people have to go and see a therapist maybe once a month or maybe even once a week? Are these people included or excluded? He talked about how it shouldn't be means tested. This, of course, means that the rich will be able to afford to their hearts. They can go to the doctor to their heart's content, while those who can't afford will have to ration their care. They'll have to decide, is this serious enough for me to actually go to the doctor? Maybe I'll put it off. I have a toothache. Well, I don't want to use up my coupons, so I'm going to bear with it. And then, of course, perhaps it becomes an abscess or it becomes something much more serious. And then you end up going into the hospital and costing the healthcare system more money because you avoided going to the doctor in the first place. This is part of the privatisation goal here. Link it to money. Look, are there people who abuse the healthcare system? Of course there are. But it should be free for all. We need to provide healthcare for all. We've seen what's happened in the United States, where people will avoid going to the doctor. People will ask people around them, during an emergency situation, don't call an ambulance because I can't afford it. I can't go to the hospital because my insurance doesn't cover that hospital. I can't go to the doctor because they're out of network or whatever. We don't want to emulate the United States. That's the wrong way to go. There's a pandemic at the moment. There are people in hospital who should have gone and got the jab, yes, but that's a separate issue. We need to fund healthcare. We can't privatize it because we don't want to fund it. There's a lack of doctors and nurses because of Brexit as well, something that Nick Ferrari, I believe, supports. The solution is not to privatize everything, to make money out of it. This is a ridiculous idea. Let me know in the comment section, guys, what you think about this idea. As always, your comments are greatly appreciated. Thanks a lot.